Welcome to Health Literacy Awareness, Teachback. My name is Karen Storms, and I'm a library and information specialist in the Northern Care Alliance. To get us started with the context of health literacy, in England, about 7.1 million adults read and write at or below the level of a 9 to 11-year-old in this country. If we think about numeracy skills, ability to do maths, the number is even higher. Why is low literacy and numeracy a problem for you as someone taking care of patients? Adults who have low skills and the children of these adults suffer the lowest health outcomes in our country. This directly impacts health literacy, the ability to understand and act upon instructions and information about your own health. Because 43% of adults struggle to understand health information using only words, and 61% of adults have difficulty understanding health information containing words and numbers, such as dosage instructions or a letter containing dates and times of upcoming medical appointments. Why is this important? I return to slide 3. Adults with low language, literacy, and numeracy skills and their children suffer the worst health outcomes in our society. To add to this, health literacy is not a constant. People with functional literacy and numeracy skills can easily lose focus when faced with a startling diagnosis, health problems relating to loved ones, or if already stressed over another situation. The example on this slide shows just how easily rattled we are by unexpected health news. Improved health literacy can save time, both for you as the practitioner and the patient. Improve your practice. Improve patient care. Improve patient satisfaction. Improve patient safety, and ensure the most effective use of resources. In other words, save money. How can we support improved health literacy? Simply put, by improving the information we provide patients. Ideally, this is taking place at the same time as initiatives to improve health literacy standards for all patients, especially those from the most disadvantaged groups. This improvement starts by considering the way we write health information. Ways to improve our written communication with patients include using short sentences, usually 15 to 20 words max. Using short, simple words. Avoiding jargon and abbreviations. Addressing one idea per sentence. Writing numbers as figures instead of words. Using as large a font as practical. Involving users in the process, asking for feedback on communication. Making sure all health information is evidence-based. If you need help getting your evidence up to date, book a session with one of the librarians. And always include a date. Here are some examples of keeping communication vocabulary simple. Instead of using the word modify, use the word change. Instead of hypertension, you could use high blood pressure. When explaining a positive or a negative result, say good or bad result. Explaining a fever, say high temperature. Explaining topical, actually say that it's applied directly to a part of the body. Another tool we have is Teachback. This is the way you, as the healthcare provider, can make sure you have explained the information clearly. This is not a test or a quiz to give patients. Start by asking the patient or family member to explain in their own words what they need to do or know in a caring way. This is a way to check for understanding and, if needed, re-explain and check again. This technique is a research-based health literacy intervention that promotes adherence, quality, and patient safety. This slide is a link to a short YouTube video about TeachBack. TeachBack in 4 easy steps. 1. The person providing the health information must accept the burden of communication. For example, saying, I have covered a lot of information today, and I want to make sure I did a good job explaining it. 2. The communication should focus on a specific behavior. For example, can you tell me when and how you take this medication? Or, show me. 3. The patient should be reassessed and instructions explained in a different way. 4. The person providing the health information needs to continue to explain as many times as is needed to confirm understanding. It's time to practice. Scenario 1. The instructions for the medication you have prescribed are: medication should be started early after onset of migraine symptoms. Dose may be repeated after 2 hours if the response to initial dose is suboptimal, unless otherwise noted, up to the maximum dose in a 24-hour period. Triptans should be avoided for patients with a history of ischemic stroke, ischemic heart disease, uncontrolled hypertension, and pregnancy. Take a moment and write down what you would change to make this simpler for your patient. More practice. Scenario 2. Medication instructions. Ibuprofen. 10 milligrams per kilogram per dose as an oral solution or tablet. This dose may be repeated in 4 to 6 hours if needed. No more than 4 doses should be given in a 24-hour period. Maximum daily dose, 40 milligrams per kilogram. More practice. Scenario 3. It's a letter. Dear patient, we have booked you an appointment with our ambulatory care unit at Royal Oldham Hospital. We will call or text you 2 days before your appointment to remind you. If you would like a telephone or video appointment instead, please contact us on 0161 624 0420. We may need to change the time and date of your appointment. Last practice. Scenario 4. Another letter. Dear patient, important information regarding your outpatient appointment. We are writing to you regarding your appointment on the 7th of August 2023 at 2 p.m. in the Lucy Pugh Outpatients Department. We are sorry to inform you that we have had to reschedule your appointment. We will be in touch with you regarding your new appointment within 2 weeks. We've looked at 4 scenarios. Were they hard? What was challenging? How did you feel? Did this inspire you to change anything about your approach? In summary, health information is too complex for the majority of the population in England. People with lower health literacy have poorer health outcomes. By making communication clearer, we can improve health literacy. There are proven techniques to help, like Teachback. That's it. Thank you for participating in this training session. To remind you, I'm Karen Storms, a member of the Library and Knowledge Services team, and we are all here to help. Please feel free to get in touch. Here are further resources about writing health information. Here are some more resources on Teachback. And this slide has further information on health literacy.